Understanding Livestock Diseases, a comprehensive guide. Raising livestock like cattle, pigs, sheep, and goats is an integral part of many farming operations. However, livestock are susceptible to various diseases that can impact animal health and farm productivity. As a livestock owner or farmer, it's important to understand the common diseases that may affect your animals and how to prevent, manage, and treat them. This comprehensive guide covers the major livestock diseases you need to know about. Cattle diseases. Cattle can be affected by both infectious diseases caused by pathogens and metabolic diseases related to nutrition and management. Here are some of the most important cattle diseases to understand. Bovine viral diarrhea, BVD. BVD is an infectious gastrointestinal disease caused by a pestivirus. It spreads through contact with infected cattle or contaminated materials. The symptoms include diarrhea, fever, runny nose, coughing, and ulcers in the mouth. BVD can also cause reproductive issues like infertility, abortions, and birth defects. Prevent BVD by quarantining and testing new cattle, maintaining a closed herd, and vaccinating. There is no treatment, but supportive care can help affected cattle recover. Bovine respiratory disease, BRD. BRD, also known as shipping fever, causes pneumonia in cattle. It is most common in stressed cattle after transport or entry into a feedlot. Viral and bacterial infections like bovine herpes virus, parainfluenza virus, Pasteurella bacteria, and Mycoplasma bacteria can all contribute to BRD. Symptoms include fever, coughing, nasal discharge, rapid breathing, and lethargy. Preventive measures include reducing stress, proper ventilation, antibiotics, and vaccination. BRD is treated with antibiotics, anti-inflammatories, and supportive care. John's disease. John's disease is a contagious bacterial infection caused by Mycobacterium avium paratuberculosis. It attacks the intestines, leading to chronic diarrhea and weight loss. The bacteria spreads through manure, colostrum, milk, or utero from mother to calf. Testing blood, manure, or tissues are required for diagnosis. John's is managed by quarantine, culling infected cattle, and keeping susceptible calves separate from adults. There is no cure, but vaccines can help control the spread. Mastitis. Mastitis is the inflammation of the mammary gland and udder tissue. It usually occurs as a bacterial infection in dairy cattle around calving or during lactation. Symptoms include swelling, pain, redness, and abnormal milk. Mastitis is treated with antibiotics. Prevent it by maintaining hygienic facilities, properly milking cows, and dipping teats in disinfectant. Pink eye. Infectious bovine keratoconjunctivitis, also known as pink eye, causes ocular swelling, irritation, and ulcers. Face flies can spread the bacteria that cause pink eye between cattle. Symptoms include excessive tearing, squinting, and blindness if untreated. Pink eye is treated with eye ointments, antibiotics, and anti-inflammatories. Prevent it by controlling flies, avoiding irritation, and vaccination. Foot rot. Foot rot is a highly contagious bacterial infection between the toes of cattle causing lameness. The bacteria Fusobacterium necrophorum and Diculobacter nodosus infects the skin and progresses to swelling, wounds, and rotting tissue. It spreads via pastures, stalls, and hoof trimming equipment. Treat foot rot with antibiotics, foot baths, and bandages. Culling chronically infected cattle may be necessary. Hardware disease. Hardware disease occurs when cattle ingest sharp metal objects like nails, wires, and machinery parts while grazing or eating feed. These objects can lodge in the stomach or intestines, causing pain, infection, and potentially death. Prevent hardware disease by keeping pastures and feed sources free of metal. Surgery may be needed to remove ingested metal objects. Swine diseases. Pigs can suffer from various bacterial, viral, and parasitic illnesses. Here are important swine diseases to know. Porcine, reproductive and respiratory syndrome, PRRS. PRRS is a viral disease that impacts reproduction in breeding pigs and causes respiratory illness in young pigs. Symptoms include late-term abortions, stillbirths, weak piglets, and respiratory distress. The virus spreads through direct contact and aerosols. All ages of pigs are susceptible, but the disease primarily affects nursery to finisher pigs. Vaccination, herd closure, and quarantine help control PRRS. Supportive care for sick pigs may be needed. Swine influenza. Swine influenza is caused by type A influenza viruses. Pigs can be infected with avian, human and swine influenza strains. Symptoms include fever, lethargy, runny nose, coughing, and difficulty breathing. Influenza spreads rapidly through herds via aerosols, direct contact, and contaminated objects. Antiviral drugs, vaccines, and biosecurity measures help control influenza outbreaks. Good ventilation is also important. Porcine epidemic diarrhea virus, (PDV). PDV is an infectious gastrointestinal coronavirus. It is highly contagious and potentially fatal to young piglets, causing severe enteritis, vomiting, and watery diarrhea leading to dehydration and death. Older pigs may show milder symptoms. PEDV spreads via the fecal-oral route. Strict biosecurity and sanitation are crucial, as the virus can live for weeks on surfaces and equipment. Sows can be vaccinated to provide passive immunity to nursing piglets. Pleuropneumonia. Pleuropneumonia is a severe respiratory disease caused by the bacteria Actinobacillus pleuropneumonia. It spreads through direct contact and aerosolized droplets. Symptoms include high fever, breathing problems, coughing, lethargy, and death. It can affect pigs of any age. Antibiotics, antimicrobials, and vaccines are used to treat and prevent pleuropneumonia. Proper ventilation is key to control. Internal parasites. Pigs can be infected by several internal parasites like roundworms, liver flukes, whipworms, and tapeworms. Larvae and eggs are shed in the manure and spread through contaminated food or soil. Symptoms include rough hair coats, stunted growth, anemia, diarrhea, and coughing. Anthelmintic dewormers are used to treat and control worm burdens. Good sanitation and rotating pastures help break parasite life cycles. Erysipelas. Erysipelas is caused by the bacterium Erysipelotheryx ruseopathia. It manifests as diamond skin lesions, fever, depression, lameness, and potentially leads to sudden death. It spreads through infected soil, feces, or animals. Erysipelas is treated with antibiotics and antimicrobials. Vaccines are available to help prevent infection and control outbreaks. Leptospirosis. Leptospirosis is a zoonotic bacterial disease that can spread from pigs to humans. Pigs become infected through contact with contaminated urine or soil. It causes fever, jaundice, vomiting, diarrhea, and respiratory illness in pigs. Piglets can die quickly without treatment. Antibiotics can be used to treat sick pigs. Vaccines and biosecurity help control leptospirosis on farms. Sheep and goat diseases. Sheep and goats share many common diseases, though some illnesses affect one species more than the other. Here are important small ruminant diseases. Scrapie is a fatal degenerative prion disease that affects the central nervous system of sheep and goats. It is related to mad cow disease but not contagious to humans. Scrapie causes changes in behavior, itching, weight loss, trembling, and loss of coordination in infected animals. It spreads most often from ewe to lamb. There is no treatment or vaccine. Scrapie can be controlled through genetic selection and herd monitoring programs. Caprine arthritis, encephalitis virus, CAV. CAV is a retrovirus that infects goats causing arthritis, mastitis, pneumonia, and brain inflammation. Kids infected with CAV may not show symptoms for years. CAV spreads through infected colostrum and milk. Blood testing identifies infected goats that should be separated or culled. Disinfecting equipment also helps control viral spread. There is no treatment, but vaccines can help prevent infection. Caseous lymphadenitis, CLCL, primarily affects sheep and goats and causes abscesses in lymph nodes and internal organs. Corynebacterium pseudotuberculosis bacteria spreads through discharges from burst abscesses, contaminating feed, bedding, shearing equipment, etc. Symptoms include external and internal abscesses, weight loss, lethargy, and poor wool or milk quality. CL is difficult to treat and control. Vaccines provide partial protection. Foot rot affects sheep and goats, causing lameness and hoof deformation. The bacteria Dichelobacter nodosus penetrates damaged skin between the toes. It spreads through wet, muddy conditions. Symptoms include limping, hoof inflammation, and rotten hooves. Treat foot rot with foot baths, antibiotics, and hoof trimming. Vaccinate high-risk animals and control environmental contamination. Zoonotic abortion diseases. Several contagious bacterial and protozoan diseases cause abortion in sheep and goats. Brucella, chlamydia, listeria, salmonella, toxoplasma, and campylobacter species pose risks to humans through contact with birthing tissues and fluids. Aborted fetuses and placenta should be handled carefully with gloves. Pregnant women should avoid exposure. Testing identifies infected animals that abort for culling. Vaccines help prevent some diseases. John's disease. John's disease also affects sheep and goats as a chronic gastrointestinal infection. It spreads the Mycobacterium avium paratuberculosis bacteria through manure contamination. Symptoms develop slowly and include diarrhea, weight loss, lethargy, and eventual death. Waste from infected animals contaminates pastures, feed, and water. Control strategies include herd testing, culling, clean calving areas, and vaccines. Parasites. Gastrointestinal parasites like tapeworms, roundworms, coccidia, and liver flukes plague small ruminants, especially young stock. Contaminated soil, food, and water spread the eggs and larvae. Diarrhea, weight loss, weakness, and bottle jaw indicate parasite infection. Rotate pastures, avoid overcrowding, remove manure, and use anthelmintics to control parasites. Dewormers should be rotated to prevent resistance. Caseous lymphadenitis, CLA. CLA primarily affects sheep and goats and causes abscesses in lymph nodes and internal organs. Corynebacterium pseudotuberculosis bacteria spreads through discharges from burst abscesses, contaminating feed, bedding, shearing equipment, etc. Symptoms include external and internal abscesses, weight loss, lethargy, and poor wool or milk quality. CLA is difficult to treat and control. Vaccines provide partial protection. Preventing livestock disease. Preventing livestock disease is critical for maintaining healthy, productive herds and flocks. Here are some key tips for disease prevention. Quarantine new arrivals. Isolate new or returning animals before introducing them to the herd to prevent disease spread. Disinfect properly. Clean and disinfect housing, equipment, and vehicles between groups. Remove manure, wash, and apply disinfectant. Control pests. Use sprays, bait, traps, and other measures to control flies, mosquitoes, ticks, and rodents that can transmit diseases. Vaccinate. Consult with your veterinarian to plan an appropriate vaccination schedule for your region and operation. Vaccines help prevent many major livestock diseases. Practice biosecurity. Restrict access to your farm. Use protective clothing and footwear, and separate sick animals to avoid spreading diseases. Get diagnostic testing. Work with your veterinarian to routinely collect samples and test for diseases of concern. Testing allows early detection and intervention. Reduce stress. Minimize transport, crowding, extreme weather, and abrupt diet changes that stress livestock and weaken immune defenses. Buy from reputable sources. Only bring in livestock from trusted farms with documented health protocols. Staying informed about livestock diseases and being proactive helps create healthier, more productive animals and herds. Consult your local large animal veterinarian if disease issues arise. With proper prevention and management, livestock diseases can be effectively controlled.